This video will explain the information about deprescribing benzodiazepines and Z-drugs. So you're probably wondering, what is deprescribing? Deprescribing means lowering the dose or stopping a medication that may no longer be helping or may be causing harm. So why do we deprescribe in hemodialysis patients? Hemodialysis patients may take up to 12 medications each day. Also, since many medications are not studied in hemodialysis patients, the benefits and harms are unknown. Hemodialysis patients may also have a harder time getting rid of medications from the body, so patients may experience more side effects. What are benzodiazepines and Z-drugs? These medications are used to treat anxiety, difficulty sleeping, or restless leg syndrome. Some common examples include Xanax, lorazepam, also called Ativan, and zopiclone, also called Imovane.
Now you may ask, why should you reduce or stop the dose of your benzodiazepine or Z-drugs? Usually, only short-term use is required. Long-term use can cause increased falls or accidents, memory problems, fatigue and drowsiness, and a dependence on the medication. After a few weeks of using these medications, they may become less effective in treating sleep or restless leg syndrome. Patients who have unmanaged depression or anxiety, which may contribute to their difficulty sleeping, or alcohol withdrawal, should remain on their medication.
So we want to reduce or stop the dose of these medications. How do we do this?
Your healthcare team will help decide the best way to reduce or stop the dose of your medication. This may include slowly lowering the dose you receive for a few weeks before stopping the medication altogether to help reduce any withdrawal symptoms.
There are a few things your healthcare team will monitor for after reducing the dose or stopping your medication, including looking for symptoms of tiredness or drowsiness, sleeping problems, restless legs, nausea, or anxiety. You may be wondering, what can you do if your symptoms continue after adjusting your medication? Your healthcare team may recommend starting a different medication, for example, melatonin for trouble sleeping, or levodopa for restless legs. There are also other ways you can manage your symptoms as well. For trouble sleeping, this includes practicing good sleep hygiene by waking up and going to bed at the same time each day, avoiding napping, using the bedroom only for sleep and intimacy, avoiding smoking, alcohol, coffee, big meals, and exercise 2 hours before bed, and meditation. For symptoms of restless leg syndrome, you can try practicing good sleep hygiene, as previously mentioned, exercise and stretching, such as during dialysis, acupuncture, and distracting your attention, such as with a puzzle.
Overall, the goal of deprescribing is to lead to better patient care. Please contact your healthcare team before stopping or changing any medications.